From the minute that you walk into Gritman's door, you're greeted with a smile and somebody welcoming you and introducing themselves, seeing what you're there for, taking you directly to where you need to go after you're checked in, and then there you get a nice handoff to somebody else who takes you in and gets you set up for surgery, and then the surgery process is explained to you pretty thoroughly. You get to meet everybody who's involved in your care, even those that are treating you while you're in surgery and you don't remember them, which is nice. And then you go to PACU, which is where you wake up from surgery with a wonderful set of nurses who get you nice and awake, and then you usually get taken to the medical surgical unit where you'll find myself and most of my nurses who then take you on as their team, and we work together with physical therapy and your physicians and case management to make sure that you are set up for the best care in the hospital as well as when you leave us. When somebody wakes up from surgery, they're introduced to the nurses that are taking care of them on the medical surgical floor. And then it's at that time that we discuss the direct plan of care, which is usually set forth by the physician. So how soon that you're going to work with physical therapy, what equipment is going to be used while you're in the hospital. People think, I'm just going to get to lay down after surgery and relax for a long time. Actually, you come in and we get a plan of care, and usually on the first day of surgery, sometimes within hours that you're back to us, we get you up and get you moving on the new limb that you have working for you. We try and provide consistent care. So while you're in the hospital, if the nurse taking care of you is on for a stretch of days, we try and make sure that that nurse is taking care of you the following day so that we are getting consistent care. Pain management is always a big concern for most patients. The physicians have a wonderful plan of care for pain management. We have different modalities, so we work with the anesthetist to do nerve blocks. We have medications that you can take by mouth, and we also have medications that we can give intravenously until the time that you can take medicine by mouth, which is usually the medication that you're sent home with. I think one of the greatest things is our physicians are very accessible. While they work alongside a lot of the other area hospitals, they're a phone call away. If any of my nurses have any trouble, I can call them or one of their assistants and they'll get back to me right away. If I were going to have family have an orthopedic surgery, I recommend coming to see them. They have a wonderful bedside manner. They're easy to talk to, easy to express your concerns. Even from a patient standpoint, I've seen it. From a nursing standpoint, I've seen it. And they will individualize your plan of care, and they will make sure that you are taken care of. I live out of the area, and I drive past 2 to 3 hospitals a day just to come to work here. We do provide exceptional care close to home, and I think that we as a facility are amazing, and I wouldn't go anywhere else.